Nestled in the heart of East Africa, the Lake Victoria region is not only known for its breathtaking beauty, but also its challenges. Among the most pressing of these challenges is malaria, a deadly disease that has long posed a threat to the health of its people, particularly pregnant women and children.
Nilikuja nikawa mjauzito na hiyo ujauzito ikatoka na 4 months. Ikawa niende hosi wakatoa kaosha. Tena Mungu akajalia ingine. Tena ikawa hivyo. Kumbe ni malaria ndio yenye ilikuwa inasababisha ujauzito wangu kutoka.
As we know, malaria is brought by mosquitoes, but we have to think of what is the cause of having mosquitoes, and then looking at how do people handle that issue. How do they usually behave? And a few of the things we've identified is that maybe they don't clear their bushes and they don't use mosquito nets.
For the past 4 years, a transformative initiative has been at work in the Lake region. Breakthrough Action Kenya, a collaborative project funded by the US President's Malaria Initiative, has empowered communities to lead the fight against malaria, improve maternal and child health, and create lasting change.
We want households and communities to actually take charge of how they respond to and react to the medical conditions and health conditions in the community. Because overall we want them to have good health, and good health means prosperity.
The President's Malaria Initiative collaborated and invested in Breakthrough Action to support its social behavior change activities. Some of the things that we were looking at was improvements, for example, in uptake of intervention preventive therapy by pregnant women, increased use of health facilities by those that need to seek services.
Our liaison with or partnerships with Breakthrough Action supported by PMI has been great, ensuring that communities understand what malaria is in the first place, and most importantly how it can be prevented, and the consequences when those efforts of prevention are not adhered to, or if people don't seek treatment.
Breakthrough Action did not only go to the community, we only also influence the behavior of the providers on the other side, so that we have a complete kind of intervention where when we talk to the community members of the how they need to take up intervention on malaria control, they also come onto the facility, and the facility also will be receptive to them so that they can change behavior.
This whole site orientation is to provide information to all the staff members so that we can enhance referral.
We were doing what we called whole site orientation in communicating to the client, where we start from the gatekeeper, every staff at the facility, how they could be addressing the clients. And this brings an environment where the community members, when they come to the facility, they feel welcomed, they feel at home, and they can share their problems and then work together to solve their health issues.
As a county, we are having issues in the uptake of malaria interventions, both at community and facility level. So Breakthrough supported the training of the county health management team in 4 high transmission sub-counties, that is Hwisero, Butere, Mumias West and Matungu. Then we introduced the health promotion advisory committee at the county. So from there we cascaded the trainings to the sub-county health management teams, where they were also trained, and we also came up with a HPAC for the 4 sub-counties.
We are trying to prevent the issue of malaria in pregnancy and malaria in early childhood.
Breakthrough Action also supported the establishment of community action groups, CAGs, where diverse voices within the community, men and women, the elderly, youth and people with disabilities come together to create locally driven solutions.
Community Action Group ya Mumias Model Facility iliundwa haswa kushirikisha stakeholders tofauti katika community ili waje pamoja wasaidiane na facility, tuhakikishe katika pale mashinani kila jamii wamepata ile ujumbe ambao tunapeana kuhusiana na malaria na uptake kiwe juu.
Mama ukigundua uko mjamzito, enda uanze clinic, utapewa neti. Itakukinga dhidi ya umbu ambao watafanya uambukizwe na malaria.
Mimi kama mchungaji pia ninachukua kama dakika 10 ili kuhamasisha au Wakristo ya kwamba kuna ugonjwa hatari unaua watu. Tukiua umbu tutakuwa tumepambana na malaria.
We are also using our CHPs because they are the level 1 healthcare workers in the community. So they're the ones who are doing house-to-house visitation of both the ANC mothers and referring them promptly to the facility because we want our ANC mothers to start ANC before 12 weeks. At the same time, our CHPs are moving again from household to household, ensuring that all our under 5 children complete their malaria vaccine treatment.
Tuna sensitize our community members. Nini inasababisha malaria kwanza? Ni jinsi gani wanaweza jikinga na malaria? Kama ni wamama wale wajawazito, kama mtu ameshika mimba mapema, wakati na realize yuko mimba, ni lazima tu aende hospitali, wamwangalie, wampee dawa ambayo itamsaidia mkinga yeye na mtoto ambaye tumboni dhidi ya kupata malaria. Community members wengi walikuwa na challenges mambo ya kutumia neti. Tunaenda ndani mpaka kwa kila nyumba, tunafundisha jinsi ya kufanya nini kuweka neti kwa kitanda kutumia.
If I visit a household yenye iko na mama mjamzito, I have got 2 IPC material. 1 is the intercommunication, then 2 ni ile kitabu ya mama mjamzito ya MOH 216. Then we have been trained on how to test, treat and track malaria victim. If that person is having signs and symptoms of malaria, we have the MRDT, Malaria Rapid Diagnosis Test Kit, or we have the malaria component ya community. So if it comes out, shows the red color, then that person is positive to malaria. We treat, we give the AL because we are given from the facility.
Mhudumu wa afya alipofika akatupa mafunzo ya kutuashiria jinsi ya kujitunza kuhusu malaria. Ikawa ukiwa mahali unapoishi uhakikishe ni pasafi, nyazi haziko kwa kiwango ya juu, maji isiwe ya kusimama kila mahali, uwe mwenye unaingia kwa neti kila wakati, ujilinde pamoja na watoto na mama mwenye watoto. Jukumu nililochukua kuhusu kujilinda na ugonjwa, nilianzia kwa kufyeka, kuhakikisha maji haisimami ambapo karibu ninapoishi.
An essential part of the project was a fishbowl dialogue, a unique discussion format that encouraged open communication between healthcare providers and community members. It created a safe space for discussing challenges in healthcare delivery and exploring solutions that could improve both provider behaviors and client health-seeking practices.
We use the fishbowl approach, and this is where we brought the health worker and the community together, where they actually have a candid discussion. So we have the health worker in the middle, let's say pregnant women, and they have a discussion. What has been good? What has worked so well? What hasn't worked well? And how can we address that? And then the exchange. The women come in the middle and the health worker at the back, on the outside. So they'd have that discussion again.
Once these sessions have been done and challenges have been identified, then the facilities come up with what we call action plans to sort out these issues.
Hiki kikao cha kukaa na wahudumu wa afya nimeona kimenisaidia sana kwa sababu nimejifunza hapo mambo mengine yenye sikuwa najua. wakatueleza tusikose kupeleka watoto kliniki kwa sababu wamama wengi wakishajifungua watoto, mtoto akishafika miezi 6 ama miezi 9 wanaacha kuenda kliniki.
Another breakthrough of this project was its targeted focus on the role of men in maternal and child health. Often overlooked in traditional health campaigns, men are key to the success of interventions aimed at preventing malaria and improving maternal and child health.
Today I went to visit a couple and talked about men involvement so that in case of any problem, the man can help her to come to the facility for the NC clinic.
Venye alitupata na mume wangu ilikuwa ni furaha. Akatupatia mafunzo kutokana na malaria. Halafu pia akatuambia ni vyema nikikujanga kliniki huwa tunaambatana pamoja na yeye.
So when we came to the hospital, we were given the first priority to see the nurse, and we were served very well. She talked to her about the anti-malaria tablets.
Another thing that Breakthrough has done, and we want to applaud them for that, they have developed a job aid for the CHP. And the purpose or the good thing about that job aid is that they uniform the way these CHPs ask questions about malaria, and you find that most of the questions that are there...
With these targeted interventions, Breakthrough Action has made significant progress in reducing malaria cases, particularly in vulnerable populations, children under 5 and pregnant women.
Wakati nilifika huko hospitalini, wakanituma nikaenda nikaona daktari, akanituma kwa labu nipime vipimo zangu zote. Wakaanza kunipea maelezo na hiyo maelezo ilinisaidia sana. Alinipea dawa, akaniambia nisikose kutumia hizo dawa kwa sababu zitanikinga mimi pamoja na mtoto ambaye nimebeba. Alafu pia wakanipea neti ambayo itanisaidia mimi mama mjamzito.
There has been an improvement in initiation of early ANC in those 4 sub-counties compared to the average county performance. And this has seen an improvement in the uptake of IPTP for the ANC mothers. From around 20%, we are currently doing 59%.
We had high malaria prevalence in Homa Bay County because people had the nets, but they're not using them. So Breakthrough Action came and we accelerated these processes to ensure that people understood the importance of sleeping under the net and the importance of pregnant mothers also coming to the facilities to pick the net, so that at least we protect each and everyone. And from that alone, we saw a shift from 17 to 3.6%.
Initially in 2018, we were around 27%, but after working together with Breakthrough, we can see that the prevalence has reduced up to 15.6%.
We also support the social media campaign, where we work with the social media consultants to develop robust social media products which are shared within various media modes. That includes the Facebook, the Instagram, the LinkedIn, and with that they are able to be linked to various health services or change their behavior. We also work with the local radio FM stations, one in Nyanza and one in Western region, where again we develop the radio spots and we support the government and key resource officers to go to the radio station and engage at the community level to educate them, and then they have call-in live moment to be able to actually respond, ask questions and respond to the issues particularly affecting them.
Lake region, that is about 8 counties, all the way from Busia, Siaya, Bungoma, Kakamega, Vihiga, Kisumu, Homa Bay and Migori. Moved from 27% in 2015 to 19% prevalence in 2020 malaria indicator survey.
In the heart of Lake Victoria, change is taking root. one village, one family, one life at a time.
Kwanza nishukuru Breakthrough. Mimi kama administrator, yale manufaa ambayo nimeona na change, mabadiliko ambayo imekuwa katika community ni ile inaweza onekana. Ukienda kwa ground utaona kwamba wananchi wameanza kuembrace matumizi ya facility, matumizi ya nets.
Wamama wengi wako na hiyo habari, sababu tunatembea kwa kila kikundi ya wamama mahali wamekaa, kila kikundi ya vijana, tumefikia watu wengi, at least a good percentage wana idea ya mambo ya malaria. So we appreciate the Breakthrough kwa ile support wametupatia na ile mwangaza wametuangazia tukakufikia watu wengi.
Maneno ya hii malaria wanatufundisha, tunapewa net, tunapewa dawa. Pia sisi hiyo mafundisho tunapeleka nyumbani. Tunaambiwa watoto walale ndani ya net. So hiyo upande wangu mimi imenisaidia sana, sababu hii mwaka sijakuwa na cases kwangu ya malaria vile, sababu hii mafundisho tumefundishwa.
Breakthrough Action Kenya kingependa kuwashukuru sana kwa sababu ni jambo mzuri walifikiria kufanyia mama kitu kama hiyo. Tunajua umuhimu wa kwenda kliniki.
Venye nilianza kwenda hizi mafunzo, sijapata malaria mpaka saa hivi yenye niko hivi, nimefikisha hii miezi. Matarajio yangu ni kupata mtoto mwenye afya, mtoto mzima ambaye hana malaria ama hana complicated yoyote.
You will realize that the work Breakthrough Action has done towards social behavior change has involved strengthening the country's national health systems. So I'm confident and certain with the knowledge and skills that they have gained over the life of the Breakthrough Action project, that these good practices will be sustained beyond the life of the project.
4 years of working in Kenya, our team have lived, worked with you all through these years, and it's been a wonderful journey. And just to say thank you to everybody who has supported us.